This is Emilio, 34 years old. He is a hardworking entrepreneur. Oftentimes, he eats at his desk, due to his work. He eats every hour, sometimes every 2 hours. Recently, he has been experiencing that there's something pressing on his lungs. Sometimes, he can't breathe well. He is seriously bloated and constipated. He feels like foods are not digesting properly. He experienced dizziness and heart palpitations. His blood pressure increases when standing. His face flushed when he pooped. His current medications are Prevacid and sucralfate. He feels better with these medications. He also has azithromycin and Zyrtec. An antibiotic like azithromycin has no effect on him. Emilio is unsure why an antihistamine like Zyrtec was given to him. What could be the problem with Emilio? Does he have hiatal hernia? Because he feels like there's something pressing on his lungs? Or is it because he is just bloated? Does he have pulmonary problem? Because he can't breathe well? Does he have heart problem, due to his unstable blood pressure? Some tests show that he has little sliding hiatal hernia, but some tests don't show any abnormalities. Emilio doesn't show any symptoms like GERD or gastroesophageal reflux disease, which is a common symptom of someone with large hiatal hernia. SIBO is slightly increased. Pulmonary function test or PFT, O2, X-ray and CAT scans are normal. Blood test is normal. His tilt table test or TTT shows positive for dysautonomia. His ECG shows PVC or premature ventricular contraction. The main problem of Emilio is damaged vagus nerves, caused by fermentation, PPI, Prevacid, and stress. As the food passes through the stomach, hydrochloric acid is released. The churning action of the stomach helps mix the food with digestive juices to form chyme, a semi-liquid acid mass. The more liquid part of the chyme is pushed toward the pyloric opening, while the more solid moves back. From the case of Emilio, he eats every hour or two. The additional solid food closes the pyloric sphincter, and works again to digest the food. This delays stomach emptying. Sometimes, the food that he eats for breakfast stays in the stomach. When the food stays longer than required, food undergoes fermentation. Fermentation is a process by which organic substances, like carbohydrates, are decomposed to form waste product. Waste products are toxins. How fermentation works specifically: food like carbohydrates will be converted into glucose. Glucose will be converted into a waste product, called lactate. Food like protein will be converted into amino acid. The amino acid will be converted into a waste product called succinate, alanine, or aspartate. Prevacid is a PPI, or proton pump inhibitor that causes defects on gastric permeability, due to changes in potassium and calcium homeostasis, not due to cell death. The inhibitory activity of PPI on other phosphatases could also trigger dephosphorylation of tight junctional proteins, a known event to alter intercellular barrier junction. Stress causes deterioration of the intestinal barrier via gut-brain interactions, caused by activation of the corticotropic releasing factor, CRF. Mast cell axis. Normally, the intestinal barrier is semi-permeable. It prevents toxins to pass through it. A defective intestinal barrier makes toxins break the barrier, and can now access, and will damage the underlying structure like nerves. What is the nerve that is affected? It is the vagus nerve. We have 12 cranial nerves that supply parts of our body in order to function. The vagus nerve is the longest that runs from brain, face, heart, chest, and abdomen. Vagus nerve regulates heart rate, respiratory rate, and digestion. Vagus nerve acts to lower heart rate, 60 to 100 beats per minute. Vagus nerve controls breathing. Slow diaphragmatic breathing and exhaling slowly stimulate to function. Vagus nerve relaxes the pyloric sphincter, thus opening it, so that stomach content empties down to duodenum. However, Emilio has damaged vagus nerve, and so the sphincter does not properly function to open. 1. Do not overeat. Give enough time before you eat your next meal. 4 to 5 hours. This helps proper emptying of stomach content, thus avoiding fermentation. 2. Take vitamin B complex. 100 mg per day. Best taken as 50 mg twice a day. B complex is the most important in maintaining good nerve action and response. Include all B vitamins. Deficiencies of B complex are common among people eating processed and junk foods. 3. Take flaxseed oil. 1 to 2 tablespoon cold-pressed oils daily. It is rich in vitamin B12. 4. Take cold water treatments. These help tone and strengthen the nerves. 5. Take deep and slow breathing. Take 6 breaths each minute. Breathe deeply from your diaphragm. When you exhale, it should be long and slow. Exhalation is the most important part, which stimulates vagus nerve to relax. This reduces PVC, due to vagal modulation of sinoatrial and atrioventricular node. 6. Get nervine herbs, like chamomile, valerian, wood betony, and mistletoe. 7. Increase fluid intake. 8. Avoid stimulants and all processed, refined, and junk foods. 9. Obtain enough rest at night. Avoid sexual enervation. The enervation is one of the quickest ways to produce weakened, degenerate, and diseased nerve tissue. Instead, balance exercise, rest, and nutrition. If you find this video helpful, please like and share. And don't forget to subscribe. To learn more, get the full course. This course will give you a complete understanding on how our body function in order to cure your illness today, in a simple and holistic manner.